So we're going to do a little AP2 review for surface anatomy, and we're also going to do a little PTA review too, so this will kind of double for both. And I'm just going to say a few things on the PTA review. We've got a review sheet that all the PTA students will get if they attend the review. But you guys can watch this review because it's going to help a lot. Okay? And again, I'm not going to go over all these muscles, but the first thing for the PTA guys that you guys are going to need to know is a whole list of muscle origin, insertion, and action. And I'm not going to go through this. That's just something that you guys can do on your own. The big thing to remember is when you're studying these, not to just memorize, but to also visualize. So if you're looking at a muscle like here, like the brachialis, I'm going to use him for all my demonstrations here. So we're going to look at the brachialis. It originates at the anterior distal humerus. Okay, it's going to insert on the ulna side, so it's the coronoid process of the ulna. So if I can visualize where that is, I can also visualize the action, right? So I know the muscle has to shorten when it contracts, so I know that this muscle is going to definitely have to flex the elbow. So you just want to visualize where that is, because even if you forget origin and insertion, if you can visualize, well, I know the brachialis is here, I can usually remember, or you can remember, your attachments, right, by knowing location, and obviously you can visualize then the action. And of course, what would be the stretch for this muscle? Anybody know? Because if you know the action, you should know how to stretch it. Stretch is going to be extension. It's always the opposite movement, right? So obviously extension, you know, if I really want to stretch everything out, I can do something like that. But it's basically going to be extension. So you can get a lot out of of your knowledge by just visualizing where the muscle is, okay? So I just want to mention that as you guys go through this list, okay? That's for all the PTA people. For the AP2 people, we're just going to jump ahead to the bony landmarks and go through basically the whole list, okay? Quadrants, regions, heart valve sounds real quickly. I'm going to try to do it real quickly on Eugene here. So real quick with abdominal quadrants, I'm going to just ask him to point to his own belly button, okay, so he knows where his belly button is. So then that gives me the bisection point, so I can visualize right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. So easy on that. If I ask him to point to his belly button again, that also gives me the umbilical region. And then I can just go from there, right? I can go up. What would be up? Epigastric region. Below? Hypogastric. Obviously, if I go back up again to the right or left, those are our hypochondriac regions. Either side of the umbilical region is lumbar region. And then either side of the hypogastric, inguinal region. So that just makes it easy, okay? So our reference is always the umbilicus. Okay, so real quick, heart valve sounds. We just want to know the location, right, where we listen to the heart valves. Okay, so he knows, I'm going to ask him because he's a student, so he knows where the suprasternal notch is, right? So it's going to be right up here. I'm going to go behind his nice blue tie here. Should have probably taken that off, but no worries. So suprasternal notch, I'm going to go down right here to the sternal angle, okay? And then I'll go ahead and go to the right side first, okay? Right side first, that falls me pretty much right into the second intercostal space. Okay, you can see that on your sheet if you're there. I'm just to the right of the sternum. That's our aortic valve. That's the region where we're going to listen to the aortic valve. Now if I just want to go over here to the left side, just to the left of the sternum, I'm now going to listen to pulmonary valve. Okay. One more down, third intercostal space, again on the left, Erb's point. Okay. Fourth intercostal space, again on the left, the tricuspid valve. Fifth intercostal space, mid-clavicular line, the mitral valve. Okay, so that's all our points there for that. Okay, so make sure you know where those are. Next thing real quick, we're just going to knock out landmarks real quickly. So we already showed you the suprasternal notch, already showed you the sternal angle. Sternum is here in general, right? Entire bone, manubrium body, and then right at the inferior tip, xiphoid process. Okay? Mastoid process, I'll show you this. Mastoid process behind the ear, okay, on either side. The acromion process, right here at the dome of the shoulder, okay. The clavicle, pretty straightforward to find his clavicle, right here, from acromion to the sternum, okay. Midclavicular line is the imaginary line, okay, that bisects the clavicle. The medial border of the scapula, so we'll spin him around for this. Medial border of the scapula, we're going to put his arm behind his back like this and just kind of relax. And I can feel that medial border right there. Pop right out. So it's an easy way to do it. So then we get him relaxed. I can also show you some quick landmarks for the vertebrae. So the one that we've been using for the students is right here. Everybody's got a little bump at the base of the neck. That's C7. Okay? So we're going to use that. That's vertebral prominens. That's a good landmark for finding upper thoracic and cervical. So C7, if I want to find cervicals, I'm just going to count up 6, 5, 4, 3, 2, 1, so on and so forth. If I want to go down, T1, T2, T3, T4, so I'm just going to count that way. Obviously, his neck's about that long, so we're just small increments up. Thoracics are a little bigger, so we have to make our jumps a little bigger. But that's what we're going to use to find the upper vertebrae. To find the lower vertebrae, I'm going to grab his iliac crest, okay, which is a landmark. I'm going to just move my thumbs medially, and I'm going to find L4. So iliac crest lines up with L4. Okay, so from there I can go down to L5. I can go down to the sacrum, okay? Or I can come back up again, count up L3, L2, L1, T12, and I can, move right up the line. So those are the ways we're going to use to find the thoracic or lumbar vertebrae or even cervical. There are some other landmarks you can use, but I think that's good enough, okay? So next what we're going to do is we're going to go ahead and do some other landmarks. The olecranon process, okay, the elbow. The medial lateral epicondyles of the humerus. So we'll spin you around here. So medial epicondyle of the humerus, lateral epicondyle, okay. Styloid processes. What side's the radius on?
Outside.
Right, the lateral thumb side, right? So this is the radial styloid process, and this would be the ulnar styloid process, okay. Medial lateral epicondyles of the femur, pretty easy. Medial epicondyle of the femur, lateral epicondyle. If I want to find the condyles, I'm going to bend the knee, and I'm going to actually be in the joint space. This is the medial condyle femur, and this is the lateral condyle. Actually, condyles are rounded bones, and they're in the joint space. Okay, so they would be technically covered in cartilage. Okay, that brings us to the back. Now we're to the medial lateral malleolus. Pretty straightforward again. Medial malleolus is the medial ankle bone. Lateral malleolus is the lateral ankle bone. Medial bones on the tibia. Laterals on the fibula. Okay. Iliac crest we did earlier. Easy to find the iliac crest by just simply grabbing the student's waist, patient's waist. You're just going to grab and push down. I'm on the iliac crest. It's a couple inches above the belt. Okay, so then we'll also do, while we're here, we'll do the iliac spines. To find the posterior superior iliac spine, it's actually where patient's dimples are. Believe it or not, the easy way to find it is simply to grab somebody's waist. When I put my fingers on the iliac crest, my thumbs are just kind of naturally fall on the posterior superior iliac spines. Okay, there's dimples under there. Okay, so anterior superior iliac spine, same thing. If I just kind of grab the person's waist, for this one I'm going to grab more of the belt line. Grab the belt line, my thumbs are going to naturally fall on the anterior superior iliac spine, which is going to be under the belt line. Okay? And then we're going to do patella. So you know where your patella is, right? Yep, kneecap. How about greater trochanter? So the greater trochanter is going to be obviously lateral side of the femur. It's actually, if you want to know where it is on somebody, it's going to be right where his pocket is. So I just poke right in here, right about the level of the pocket. I'm on his greater trochanter. It's very bony. If I really want to know for sure where it is, I could ask him to spin his hip, kind of medial lateral hip, and I feel it roll under my hand. Okay, last but not least is the calcaneus, which is going to be his heel. Okay, it's going to be his heel bone. Okay. Alrighty, that brings us to muscles now, muscles and soft tissue. So we're going to just keep moving on. We're going to do thyroid cartilage, right, which is going to be right here. Supraclavicular fossa, it's the little indent superior to the clavicle. Okay. Axilla, you probably know where your axilla is. I'll let you point to that, you know. Armpit, right? Nuchal ligament, we're going to spin you around here. Nuchal ligament. Ligament on the spinous processes in the cervical spine, so to feel that, just flex, and that little ligament pops out. Okay, the nuchal ligament. Okay, spin around again. We're going to do the hypothenar and thenar eminence. Right, so thenar eminence, hypothenar eminence. Okay.
Can you point those out again?
Sure. So thenar eminence and hypothenar eminence, two little fleshy areas of muscle in the hand. Okay. Then we've got the cubital fossa, which is the elbow, right here, the little elbow fossa. And then we've got the popliteal fossa, which is behind the knee. Okay. Wrist extensor muscles and wrist flexor muscles are next. Okay, so the wrist flexor muscles are always going to be anterior surface of the forearm, right? Flexing the wrist, flexing the fingers. Wrist extensors, therefore, are going to be posterior forearm, right, for extending the wrist. Okay. Obviously, there's a bunch of muscles in this area. That's just a general group I'm referring to for either side. Okay. And what we're going to do next, we're going to go ahead and do the biceps femoris tendon. Tendon behind the knee on the lateral side. If he bends the knee a little bit, I can feel it really easily. It's a big ropey tendon right here. If I want to feel the medial side, I feel the semitendinosus tendon, okay, on the medial side. Sternocleidomastoid, we'll go ahead and get his to pop out, so we'll flex your head. We're going to actually rotate a little bit, and this muscle's going to pop right out right here. That's sternocleidomastoid. Okay. Then we're going to do pectoralis major, straightforward. We're going to do the rhomboids. Rhomboids lie between scapulas, minor and then major. Okay. And then the rotator cuff muscles. So we'll briefly show some easy ways to find the rotator cuff muscles. Supraspinatus is right here on top. It's deep to this upper trap. Okay, so right in here. You know, actually, here's my acromion, or here's his acromion. So if I move a little bit medial, fall right on supraspinatus. Okay. So if I want to find, we'll go to this side now. Here's his spine of the scapula. So we know supraspinatus again is right up here. We're going to go inferior to the spine. Then we know we're on infraspinatus. Okay. If I want to go right below that, we get to a really small muscle, usually kind of sore, teres minor. Okay. Now I'm going to throw this one in now. It's not a rotator cuff, but we'll throw it in. Teres major. Okay, right below it. Okay. Last rotator cuff, the one I skipped, spin him around again. Subscapularis. So where is subscapularis? Anterior surface, scapula. So the easiest way to do that, just shorten that a little bit, is we're going to feel in here, and we're actually going for the anterior surface of the scapula. Okay. So that's subscapularis. Then we're going to do latissimus dorsi. Okay. Latissimus dorsi. And do deltoid biceps brachii. So deltoid, pretty straightforward. Here's his deltoid. His biceps brachii, right here. Triceps brachii, back of the upper arm. Okay. Upper trapezius, we showed you earlier, right here. Brachioradialis, probably remember that one. We always want to find brachioradialis with the thumb up. Arm in the flex position, here's brachioradialis. Flexes the elbow with the thumb up. Okay, brachioradialis. Rectus abdominis, ab muscles. Quadriceps femoris is next. We're going to do 4 parts of the quad real quickly. We're going to do one in the middle and on top, most superficial, rectus femoris. One deep to that, vastus intermedius. Laterally, right here, vastus lateralis, medially, vastus medialis. Okay. Just a few more, gastrocnemius, calf muscle. Okay. Achilles tendon is its tendon, right down here. And then last but not least, we're going to do tibialis anterior, which is the anterior shin muscle here. This is the tibia, so it's just lateral to the tibia. Okay. Then we go quickly into joints. Okay, so we're going to start with the sternoclavicular joint. Joints, you got to remember, are always named by the 2 bones that make up the joint. So we've got the sternum, we've got the clavicle. So if I find where they meet, there's the sternoclavicular joint. If I want to find the acromioclavicular joint, I find acromion, clavicle, and I find the acromioclavicular joint. Okay. Glenohumeral joint, always the ball and socket joint, the shoulder. So there's my glenohumeral joint. Okay. Humero-ulnar joint, right here between humerus and ulna. This medial humero-ulnar joint. That is the hinge joint for the elbow. Real important to differentiate between the other 2. Radiohumeral joint is between radius and humerus. It's on the lateral side. That is a pivot joint, okay, for pronation and supination. So is the proximal radial-ulnar joint. Right dead center in the middle of the elbow, also a pivot joint. Okay. Then we do metacarpophalangeal joints, 1 through 5, right? What people call the MCPs. Number 1 is thumb, right? There you go. Interphalangeal joints are simply small joints between phalanges, okay? Proximal and distal, proximal and distal, proximal and distal. The only single interphalangeal joint would be the thumb, okay? Then we go to the coxal joint. Coxal joint just refers to the hip joint, also ball and socket joint. Basically, I'm just going to point in this area, it's in the groin. Okay, so we're pointing in the groin for the coxal joint. Tibiofemoral, just a fancy name for describing the knee. Obviously between tibia and femur, so we're just describing the knee. Whereas there's a patellofemoral joint, which is this small joint behind the patella. Then there's also a tibiofibular joint, right? Technically a proximal tibiofibular joint, which is going to be on the lateral side of the knee here. What I feel for is the head of the fibula, right there. Okay, then we're going to do sacroiliac joints. Easy way to find the sacroiliac joints is you're just going to look for your posterior superior iliac spine. So if I grab the iliac crest, find my posterior superior iliac spines again, I know that those are lateral to the sacroiliac joints, so just medial to those is his sacroiliac joints. Okay, so they're going to be in that same general area. Okay. Then we're going to do proximal. We did tibiofibular joint. We'll do the ankle mortise joint. You could also call it tibiotalar or talocrural. It's nothing more than his ankle joint. Okay. Last but not least, temporomandibular joint. TMJ. I get it open and close. Yep, and I'm on the joint. Awesome. And then last but not least, I'll go ahead and demonstrate on him. Why not? We'll go through the joint movements, okay? So let's do shoulder movement, keeping in mind that hip's the same joint, so it's the same movements, but we're going to do flexion, shoulder, this is flexion, back to neutral's extension, and we would refer to this as hyperextension, abduction, adduction, okay? Then he would internally rotate, externally rotate. So I don't know if you see that, we'll keep that bent a little more to see that. So internal here, external rotation, again there, okay? Only other thing you can do is you can do a circumduction as well. So those are all the movements of the shoulder. They'd be identical for the hip. Okay. Another quick movement would be wrist and hand. We can flex. We can extend. Good. Next, let me do that again just to flex, extend. Actually, this would be a hyperextension. Then we can ulnar flex and we can radial flex. Okay. Scapula, this is a good one because we can demonstrate the scapula. He's going to shrug his shoulders up. We call that elevation. Back down, depression. Round his shoulders forward, that's protraction. Squeeze his shoulder blades together, retraction. And we'll call when he raises his arm up like this technically would be shoulder abduction. He's also upwardly rotating his scapula. It's hard to see without the shirt on, but he's upwardly rotating his scapula. As he lowers his arm, it downwardly rotates again. Okay, so to get 180 degrees of motion, scapula has to rotate up. The rotation of the scapula begins usually right around 90 degrees. So from here up, rotation of the scapula. Okay? So don't get those confused with movement of the shoulder. Okay? Elbow, real quick. Elbow's pretty straightforward. We got flexion, extension, and then of course we've got supination and pronation. Okay? Head and trunk's the other tricky one, so we'll do the head movements. We've got flexion, extension, hyperextension. Good. We're going to do left rotation, right rotation. Good. And then we're going to do one more, knee to the shoulder, or knee, sorry, ear. There we go. Lateral flexion left, lateral flexion right. Good. Then we're going to do knee. Flexion and straighten it, extension. So easy enough. Last but not least, we'll see if you know these. If you do foot and ankle, we're going to do dorsiflexion, plantar flexion, okay, inversion, yep, eversion. Awesome. That's all of them. Thank y'all so much.
Thank you.